Good morning, good afternoon, and good evening to our participants. I am Cecile Fruman, the Director for Regional Integration Engagement in South Asia at the World Bank. And I'd like to welcome you all today to our 7th One South Asia conversation. This is our bi-monthly series where we discuss topics of regional integration and cooperation in South Asia. Today's discussion is on harnessing technology to build human capital in the region. This leverages the recent release of a World Bank book by my colleagues in human development called The Converging Technology Revolution and Human Capital, Potential and Implications for South Asia. This is a great book and I highly recommend it to all of our audience today. Investing in human capital is a new and key area of focus of our regional integration cooperation engagement strategy for South Asia. We added this, as you can imagine, in response to the pandemic, but also because we see many emerging opportunities for collaboration in human development in South Asia. Our other key pillars are regional economic integration and building resilience, in particular to climate change. So why today's conversation? First of all, we know that South Asia faces persistent human capital deficits, and many of these have been exacerbated by the COVID-19 pandemic. Secondly, the pandemic has shifted the focus to the use of multiple technologies for delivering health, education, social protection, and employment services, and for building greater resilience to pandemics and to climate. However, we know that the use of technologies is not without challenges and risks, and also that regional cooperation in these areas remains very nascent and certainly underutilized. So these are the topics that we're going to be exploring today. We are joined by a wonderful lineup of speakers who have put technologies to the use to foster human development in South Asia. Let me introduce them. First of all, Dr. Sania Nishtar. She's the Federal Minister and Special Assistant to the Prime Minister of Pakistan on poverty alleviation and social safety. Sania founded and leads ESAS, a pioneering multi-sectoral poverty alleviation and welfare program for Pakistan. Turns out that Sania is visiting Washington, so we have the benefit of having her physically with me in the room here at World Bank headquarters. One of our first times back in the office, I must say. Followed by Sania is Anita Gurumurthy. She's the founding member and executive director of IT for Change, a nonprofit that works for digital equity and rights in India. Professor Khondaker Mamun is the founder and CEO of CMED, a healthcare startup in Bangladesh that provides preventive healthcare services to over 3.3 million people. And Mr. Rabi Karmacharya, who is the founder and director of Nepal, a social organization that works to integrate technology to enhance education access. And we're also very fortunate to be joined this morning by Mamta Murthi, who's our Vice President for Human Development at the World Bank, who will be sharing some opening remarks. So before we dig into this wonderful conversation, let me just remind you that you can post your questions at our World Bank Live page. We have 3 of the authors of the report, Sajita Bashir, Klaus Tilmes, and Naoto Kanehira, who are acting as bloggers. So you've already seen that they've started to answer some of your questions. They will continue to engage in the conversation, and we'll also be taking some of those questions into our conversation, posing them to our panelists today. We've had great engagement on our World Bank Live page so far, and thank you for your interest. We've had over 2,000 visitors, and many of your posts really point to the need to empowering women with digital skills. And I promise you that that's a topic that we will be addressing fully in this conversation. And then finally, a reminder to take our poll. It's at the bottom of the page, and we will be reading out the results at the end of this session. So without further ado, let me welcome and thank Mamta for joining us today. Mamta, over to you.
Thank you very much, Cecile, and hello to everyone all over the world who's joining this conversation. I'm delighted to be addressing you today on this very important topic. We are indeed witnessing tremendous changes in the way we live our lives and access services. And many changes have been accelerated by the pandemic. Indeed, with its devastating impact on lives and livelihoods, COVID-19 has also pushed us to use more intensely some of the tools at our disposal, including technology. Let me say that even before COVID-19, technological change was already well underway and accelerating. And if I can give an example from my own past, I think of myself as a young person. Let's say 20 years ago. I was a young person more than 20 years ago, but let's just say 20 years ago. As a student, one would have to take a bus to go to a library or a store. If one wanted to buy a book, one would have to first go somewhere and get cash and then go to the store, buy the book, take the bus back home. If the bus broke down, then there was no chance that one could contact someone immediately on the spot and let them know. If I got home and there was no electricity, there was no way I could read the book that I got from the library or that I purchased. Today, this has changed. The experience of many students in urban areas is that they can buy a book, pay online, have it delivered to them. In many cases, they can read materials online. They can make payments from on the internet, and they can carry out many important tasks like registering for a vaccine on the internet. Now, these facilities are not available to everybody. It depends on having access to electricity, access to the internet, in many cases having a smartphone. But the trend for change is there. And although many more need to be reached, there are many that are already benefiting from these changes. There's another example that I like to give, and that has to do with solar energy. In India, my home country, local markets have been completely transformed by the availability of cheap batteries and solar-powered light, which allows markets to stay open longer and keeps the streets safer. Now, I would say that driven by access to electricity, access to the internet, mobile telephony, large-scale connectivity, big data, and artificial intelligence, technological disruption can accelerate the thing that we are here to talk about today, which is human capital and opportunities for people. All of this, of course, can only be realized if the most vulnerable and the marginalized have access to these technologies and the benefits that they offer. I would also say that the implications of this revolution are critical for the South Asia region, which faces multiple challenges. It's amongst the most susceptible to environmental and climate catastrophes. It has deep social and gender inequalities. It also has one of the lowest levels of human capital in the world. In South Asia, a child born in 2019 can expect to attain less than 50% of its full potential because of the access to the quality of the services that the child has access to. So that's the reason why the South Asia team has put together this report. It's really trying to address this question of how converging technologies can improve human development outcomes. What are the challenges that these technologies bring, and how can they be harnessed? And I'm really very, very pleased with the publication, which explores these two separate dimensions, both the potential and some of the risks. Let me talk about the potential and the successes first. I've mentioned this already, that COVID-19 has exacerbated development challenges in South Asia and elsewhere. It's a health crisis to start with, but it's morphed into an economic crisis, an education crisis, and a social crisis. But the technology that it has also helped enable leapfrogging in also has also brought opportunities. We know that it's been a great opportunity to develop vaccines, tests, and treatments. It's been a great opportunity to switch to digital and online learning. it's been a great opportunity to ramp up social assistance payments to the most vulnerable. And we'll hear many such examples today from our very distinguished panelists. But beyond these immediate applications, there's also the possibility to fundamentally transform the way services are delivered in sectors like health, education, nutrition, social protection, and the opportunity to make these services much more inclusive, to improve the quality of services, and also to make services more personalized and customized. Converging technologies also allows for improvement in sectors as varied as food, water, sanitation, energy, and transport, all of which contribute to the building of human capital and improving opportunities for people. So the potential is immense. Now, let me speak a little bit about the challenges. Technology is driven by the private sector and primarily benefits the most affluent sections of the economy, those who have the means and those who already have better access to services. And so it runs the risk of deepening South Asia's existing human capital inequalities and inequalities in opportunity, unless there is very deliberate public action and public policy to combat this widening of inequalities. Another risk is that technologies also replace human hands and can potentially displace millions of people from work. But on the upside, these new technologies also create new jobs for those who acquire desired skills. And they can also improve the quality of work for those who have jobs. Again, this requires very careful thought and planning and deliberate public policy. I suppose the thing to emphasize is that the technological revolution needs to empower people, all people in all aspects. Data and artificial intelligence, about which we will hear some more, can deliver tangible benefits, but they can also disempower marginalized communities and exacerbate the exclusion of those who are data invisible, so to speak. Finally, I should mention the other risks that arise from these new technologies, which relate to digital abuse, exploitation, and disinformation. And all of these can lead to a fundamental breakdown of trust and social cohesion. To forestall these outcomes, we need regulation and governance of data and new technology. These are frameworks that governments will need to work on. There may also be the need for even newer solutions that we haven't thought of, but these are some things that governments and civil society can work on. I don't want to end on a note of risks, so I'd like to talk a little bit about the potential that these new technologies provide for greater regional cooperation. Countries in South Asia can work towards common frameworks for data and technology governance. This will facilitate cross-border investments in sectors like education and health. Converging technologies can also open the scope for new avenues in regional cooperation that can, for example, use open source platforms, e-commerce, build an ecosystem of entrepreneurs and innovation. There's scope for strengthening data exchange to work together on things like energy trade, on disaster risk management, on pandemic management. In short, I do believe that these new technologies provide the potential to overcome the great physical, historical, and political barriers in the region. Finally, a few words on what the World Bank is doing. At the World Bank, we're working very hard to invest in opportunities to take advantage of what these new and converging technologies offer. Out of our commitment of about $15 billion for supporting human capital, around 40% is focused on technology and technology-related components. We commit to maintaining this focus on technology so that countries in South Asia can take advantage of the enormous potential these technologies have to empower, to innovate, and to accelerate human capital and human opportunities. We will continue, in addition to our investments, to engaging on analytical work that identifies future trends and supports policy dialogue on frameworks that can be developed to support human opportunity. With that, I'd like to conclude, and I hope today's conversation offers many insights, and we will go forward on this path with new insights and opportunities for learning. Thank you, and back to you, Cecile.
Thank you very much, Mamta, for those remarks and for setting the stage for our conversation so well. Much appreciated. So we're going to dig right into the discussion, and I'm going to start with Sania, who's here with me in the room. So Sania, you lead ESAS. It's the government's flagship social protection program in Pakistan. And during COVID-19, it faced one of its biggest tests. Nearly 25 million people held informal jobs in Pakistan and were immediately impacted by the crisis. So how did you use data innovation and delivery systems to target those hard-to-reach groups? And are there any lessons for other countries in South Asia?
Good day to everybody, and thank you very much, Cecile, for inviting me to this very exciting panel, and it's wonderful to be here with you in the room. Well, as Mamta just said, COVID-19 was not just a health catastrophe, it is also an economic catastrophe, particularly for individuals who work in the informal economy, workers that earn daily wages and piece rate earners. So in my country, COVID-19 lockdowns decimated livelihoods at an unprecedented scale. So to respond, our government allocated over $1.23 billion to deliver emergency cash assistance to 16.9 million families. This meant 100 million people, or half the country's population, which is the 5th largest in population terms globally. This was the most extensive social protection intervention ever in the history of the country, and it was being delivered during the most difficult situations in terms of the context of delivery. In terms of how it was done digitally, there were 3 digital capabilities which were brought into play to deliver what came to be then known as a SARS emergency cash. A SARS is the Urdu word meaning compassion, and we labeled it as the emergency cash instrument for the program. So as I said, there were 3 digital capabilities, all of which had been developed in the year prior to COVID in 2019. The first capability was a biometric payment system with special features. The second capability was a demand-side SMS-based request-seeking mechanism. And the third capability was a new wealth profiling, big data analytics mechanism. Now we pulled a thread through these 3 digital capabilities and built the delivery system for what came, as I just said, it came to be known as a SARS emergency cash. The front-facing communication was such that it asked individuals who were in stress during that period to send their unique 13-digit national identity card numbers on an SMS short code. That SMS short code was 8171, and the program came to be known as 8171. This short code was widely known, and we received, after we started advertising, we received 139 million requests, of which 66 million were unique. This was a very large number of individuals seeking assistance. And of course, there were many individuals from one household that also sent the request, which is why ultimately it was 15 million that ended up getting supported. Now, once the SMSs arrived, we adopted a hybrid targeting approach. So we used the National Socioeconomic Registry and increased the threshold of assistance on the one hand. And on the other, we used data innovations for the first time. So we used data analytics for decision-making and resource allocations. And there was a very deliberate public policy action. And I'm quoting Mamta here because she said that if you want to use technology to benefit disadvantaged populations, there has to be a very deliberate public policy action to thread through technology within the system. So the reason why we used a hybrid target approach was because our national socioeconomic registry was 10 years old back in 2020. We have now completed the new registry. But when COVID struck back in February of 2020, we were looking at a registry that was 10 years old. Therefore, we had to use a hybrid approach. We checked applicants against the registry, but then we also employed wealth analytics. Now, the good thing is that Pakistan's personal 13 digits identity number is linked to information about travel, taxes, billing, asset ownership, and government employment status. So we use these parameters as wealth proxies for eligibility ascertainment. And the system that we developed, which essentially meant at the front end receiving the SMSs, then at the back end checking them against survey data and running the wealth analytics, and then subsequently sending out SMS messages for the payment notification. This system was end-to-end data-driven. There was no space for human intervention or maneuverability or tampering with the criteria. It was fully automated, it was rule-based, it was transparent. And the good thing is that it was also politically neutral, because Pakistan is a very large and vibrant federal polity with different political parties ruling different federating units. So there was huge acceptance of this program, because everybody saw within a matter of a week that the benefits of that the program was actually accruing benefits in every nook and corner of the country, in every street and village, but at the same time it was very apolitical. Coming back to the process, once people were declared eligible, they were sent SMS messages to collect their payment at thousands of campsites, which we had set up across the country. And within these campsites, there were 2 commercial banks who had set up their branchless banking networks. So their agents had these little point-of-sale machines. They sat within the campsites. And the hardware that they were using had the capability to take thumb impressions. And then the biometric signatures of these thumb impressions were verified in real time from the National Database Registration Authority. And once they were authenticated, people were paid, and they would just go home. And then there was broad-based public announcements that you need to sit at home. The government is giving you this money so that you don't have to go to work. Please buy rations and sit at home. Now, we believe that this mass-scale assistance, where technology was the backbone, averted a major humanitarian catastrophe. And when we conducted a pulse telephonic survey when the operations were ongoing, and that survey showed us that 97% of the beneficiaries utilized the full amount, and 93% actually spent it on food and rations. So with great humility, I would like to say that of all the cash transfer programs globally in the wake of COVID-19, ours was the fastest and the 3rd largest in terms of the percentage of population covered. For Pakistan, this was truly a watershed moment in terms of government functioning. It made the government more agile, more data-driven, more experimental, more ambitious, and it helped with the fast-track adoption of digital execution and new ways of coordination across multiple stakeholders, because there were many stakeholders involved in the execution, although we controlled it centrally in terms of coordination and overall design. What was most important was that this intervention cemented the relationship of citizens with the state, and it bolstered the confidence in the government's ability to execute well at scale. It was truly quite unique in terms of government functioning for our country. Now, there are many learnings from this execution, but I'd like to share 4, because Cecile, I know, would like me to talk about it, and Mamta has very eloquently talked about the potential for regional cooperation and the imperative post-COVID as well. So very quickly, I'd like to refer to 4 learnings from this experience. Firstly, and at a nuts and bolts level, very much with a technological lens, very much from the execution lens, and from the systems delivery lens. Our experience has specific learnings for other countries that utilize unique personal identification systems, because it demonstrates that if you combine cell phone, SMS messaging, internet connectivity, national identities, numbers, and the capabilities of commercial banks, which exist in almost all of our South Asian countries, then you can develop a demand-based system to enable those in distress to seek social support. Essentially, by combining all these elements of the system, you can create an adaptive system which contributes to building resilience at scale as well. So that in a nutshell is the first takeaway. And the reason why I specifically mentioned cell phone SMS is because the penetration of smartphone is not as high as we would like to in our countries. And therefore, we still are, and while of course all of our countries are working to reduce the cost of cell phones, smartphones, we still have to live with a context where SMS messaging has to be used for delivery mechanisms if we have to develop them and scale them up today. Secondly, our experience has taught us that data innovations and digital delivery systems can only be deployed when there's a commitment to integrity, transparency, and accountability overall. Because if government itself is trying to game a system, if functionaries are trying to create the space for maneuverability, then this is not an approach they are going to adopt. And I generally believe that if you combine a good intention and integrity and a commitment to transparency with digital approaches, and if you're willing to shop around and mine from within your own system the various capabilities that can be threaded together to construct a delivery system, then it is only then that you have the capability to address the long-standing fault lines that have plagued public sector delivery in countries like ours. Thirdly, we learned that in order to develop a solution at scale, you need to draw on the competencies of many sectors across the public and private worlds. I recall in 2013, in 2013, I was a cabinet minister for the first time. And I was in an interim government. And when I stepped down after a few months, I wrote a paper in the Lancet about my reflections. And I wrote about 4 reflections. And one of the key reflections was that in order to deliver, you have to borrow competencies from various ministries. And as opposed to that, there is no incentive within government systems to forge that collaboration, because we think governments is one entity, but governments all over the world are not one entity. It's an archipelago of many institutions and ministries that have a disincentive to collaborate. So creating those incentives to develop systems is absolutely crucial. And we were very pleased that we were able to join many dots and draw on the strengths of many stakeholders as we executed. Finally, our experience in delivering SARS emergency cash showed us how cash transfer programs can be deployed to counter the socioeconomic fallout from COVID-19, which presents really a long-term predicament. And it is with this in view that I wrote a report which has details about the implementation challenges of SARS emergency cash and the know-how gained in designing and implementing this massive national program in real time in a context of complexity and uncertainty with speed. So I will share in the chat box a link of that report shortly. Thank you, and over back to you, Cecile.
Thank you, Sania. And it's really quite a remarkable story you're sharing with us there. I'm going to turn now to Mamun in Bangladesh. So Mamun, you're really at the forefront of health tech and doing some very, very innovative work. Can you tell us how technology is changing the health landscape in Bangladesh? And what has been your experience in using AI and tech during the COVID crisis, particularly? Over to you. And we're going to keep our remarks to about 5 minutes, please. Thanks.
Thank you, Cecile, and thank you so much for inviting me, and very good morning and good evening to everyone. So I think before talking about the digital health landscape in Bangladesh, we need to actually back to the 2008, our government's initiative about digital Bangladesh. In 2008, government took the big ambitious initiative that government wants to digitalize everything. And that actually put the fundamental foundation for actually building digital Bangladesh, and that lead to the health. So from 2014, I'm working on the digital health landscape. So what we found that technology is embracing everything, and AI and cloud and smartphone-based solution actually focusing. And you will be happy to know that, and from 2010 to 2020 in Bangladesh, huge penetration of mobile financial service, that you can use your smartphone or normal phone to actually send the money from one place to another place. That actually give the access to finance. So leading with that, in 2015, we actually started initiative on how technology can actually helping the changing the landscape of healthcare. And in that context, we actually found that use of technology, especially in healthcare, is very limited, and you will be understand that most cases our digital system only used for the registration in different hospitals. So on the other hand, we don't have like any health record systems, and we don't know where to go when we have a problems. And in that context of our healthcare, NCD is one of the biggest challenge in our community in the Bangladesh, and as well as there is no health protection, and also there is a like huge burden of healthcare. So in that context, we don't have the data. But what happened with the digital initiative, that through the digital interventions, we can actually see the data-driven solutions for identifying problems where we need to allocate the resources. And in that context, we actually run a research that why healthcare is in Bangladesh is not so as good as what we expect. And in that context, we found one of the very important findings, that all the focus in healthcare is mostly focusing on secondary and tertiary care, and mostly in traditional approach. On the other hand, and all the international organizations, everyone's saying that if Bangladesh can focus on preventive and primary healthcare, they can actually control or reduce 80% of their secondary and tertiary care loads. And in that context, we actually started with building ecosystems as digital platforms that actually embedded with IoT, Internet of Things, artificial intelligence, and cloud, and that use a smartphone to reach to the doorsteps. And it only happened because our Prime Minister actually made a commitment that service should go to the doorstep of the people. Rather, people go to the service in the traditional way into the different places. So that actually inspired us to build ecosystem that we create a trained workforce who go to the doorsteps, provide the preventive and primary health care, and create, most importantly, I emphasize here, most importantly, creating a health account which ensures digital health inclusion for every family member, that is every citizen of the family, of the community. So in that way, we actually able to capture around 51 regions of our country, and actually give us 1.3 million people. And based on that service, we can actually see that what problems, what disease is actually more in which areas. And that experience gives us huge opportunity to actually address the COVID-19 pandemic. So while in March, Bangladesh first got the first case of COVID-19, then what happened? We actually partnered with our government, our Director General of Health Service, and other government bodies and all the private sectors. We actually handshake together and developed a artificial intelligence-based COVID-19 surveillance systems, which actually covers finding the suspected cases and contact tracing and referring the person who need the test and quarantine and hospitalizations. And you will be happy to know that based on our experience that we actually developed previously, within a month, we actually deployed these AI-based COVID-19 surveillance systems all over Bangladesh using government's 14,000 community clinics, in very short time. So the learning we got, if you have the digital infrastructure ready in the country, you can actually utilize that infrastructure to actually combat the different challenges like COVID-19, and which actually help us to actually reduce the transmission of COVID-19 that actually happened to many countries. And we use that data for zoning, for finding that where need to do the lockdown, where we need to make the blockades, so that we can reduce the transmission. And with that, you know that in Bangladesh we had a digital vaccine registration system, and with that we actually registered all the people who are actually eligible for vaccine and manage their vaccine delivery, and also tracking their consequence of vaccine, and that also connected to our national database. So our national database is very effective. So we actually verified all the citizens who actually registered for the vaccine, and we actually immediately get to involve there. So in that way, what we learned from the COVID-19 and our previous experience, so if we can utilize more and more technology and applying and adapting solution based on technology and data driven, we can easily manage the healthcare and reduce the cost, most importantly, reduce the cost of healthcare very effectively. So what I think Sania said, that they use the data, and that data help them to actually where to put the more resources, where more attention is needed. In the same way, in Bangladesh or in the South Asian region, and we have a lot of people who don't have technological adaptation yet. But if we can use more and more adapting the technology, especially AI, IoT, and data analytics, we can easily actually combat our many problems, and we can reach out to the doorstep of the people, actually serving people. And in that way, we can create a healthier South Asia with regional cooperation and sharing our shared knowledge, experience, and most importantly, technology. Like one technology in Bangladesh doing good, we can scale that technology in other countries. On the other hand, like another technology is good in India, we can scale to other countries like Bangladesh. So in that way, technological adaptation and regional cooperation will help change the healthcare landscape of Bangladesh and South Asian region, and we can actually combat all the challenges that will come in the future. I thank you.
Thank you. Thank you very much, Mamun, and thanks for sharing the perspective from Bangladesh, but also expanding to what is possible for South Asia. I'm going to turn to Rabi now. So Rabi, your organization, Ole Nepal, is working to integrate technology to improve access to education with open source digital platforms and teacher training. So how effective have you been to connecting to local communities, and how did education pivot during the pandemic?
Thank you. Thank you, Cecile, and good day to everyone. So Open Learning Exchange Nepal, also known as OLE Nepal, was established in 2007. Our aim was to see how we can leverage technology, a lot of advancements, innovations taking place in technology, starting the beginning of this millennium, to see how we can leverage that to improve the quality of education in public schools. By quality, I mean how can we provide a better learning experience for students and children, even in the remote areas, and also using technologies to sort of provide better access to learning tools and resources for children in schools that are very under-resourced until now. So we are very, very aware that in this whole region, in Nepal and in South Asia region, education is still delivered in a very traditional manner. It's still lecture-based. No matter how much we talk about, advancing education, there's little change that we can see if we actually go to schools, except for a few private schools and well-funded and advanced schools in a handful number of schools. There are many. Majority of the schools are still run in a very traditional manner. It's rote learning is going on. So that is actually leading to a lot of students sort of dropping out, not interested in learning because they don't find the experience very meaningful. So we saw this opportunity to introduce technology in this kind of setting. So in a way to also empower the students, empower the learners, so the learning is more in their sort of control. So when they're engaging with kind of this digital platform, it allows them to interact. It allows them for a lot of self-learning, a lot of peer learning going on there, and sort of teachers also playing the role more of facilitators. So it's a more of a kind of paradigm shift that we're trying to introduce with technology, so that children have a better learning experience. And we also talk a lot right now. I think Mamta also referred to this. We talk about the fourth industrial revolution. We talk about knowledge-based economy, but we are not preparing our human capital to actually benefit from that, to actually take advantage of what's available out there. Nepal, for example, many of our youth end up going to foreign countries to work as migrant workers, and most of them work on very kind of low-skill jobs, and that's been their goal. I mean, there's a majority of children who want to grow up to go and work in India or Dubai or many places. So we need to turn that around. If you really want to build this nation, and if you really want to build this region, to leverage technology and to actually and to take advantage of what's out there, opportunities that's available after the fourth industrial revolution, we really need to prepare our capital, human capital, to be able to understand and to be critical thinkers, to be creative, to be better problem solvers. And currently, our education system has not been able to deliver that. So we need to change that. And Open Learning Exchange in Nepal, we've been working closely with the Ministry of Education, with local communities, local authorities, parents, and teachers to see how we can change right on the foundation level. We start from like early grades in the primary level, because what we found was that many of the technology interventions are introduced in high schools, secondary schools, or tertiary university levels. We believe that it's a little too late to do that, because we want to change the way students approach problems. And then if you really want to build them the kind of skills that's needed in today's economy, we have to start early. So we've been working with communities in that way to see how we can change how schooling is done. And our successes, actually, if you look at it, are in places where there's more community engagement, where there's kind of good leadership, and there's a commitment from the local authorities to actually bring this change in their communities. And so it's also very imperative for the community to understand why we're doing it. It's not just, oh, our kids are learning computers. It's about for them, to parents, to understand, even if they're illiterate, to understand that the way the children are going to learn is different. How can we contextualize learning? How can they sort of assist in their own, like, even if they're illiterate, how they can assist the kind of assist in creating the ecosystem at home. So that community relation is kind of very important. Now, quickly coming back to the kind of what happened after the onset of COVID pandemic. Obviously, I think with as with most of the world, the schools had to be shut down. There was a nationwide lockdown, and suddenly there was a big focus on, oh, now is it going to be digital platforms and online learning that's going to sort of save our schools? But there was not enough preparation done before, so we started to do it a little too late. We did sort of assist the government in setting up an online portal. We provide all our digital content for free access for students. But at the end of the day, only 7% of the population in the country actually have access to broadband, reliable internet along with devices at home. And those are mostly in urban, in the rich sort of socioeconomic pool. So that left a huge number of students, a majority of children without access to learning. And there was a lot of learning loss that took place last year. And there's, although the government did, after a few months, introduced an alternative approach to education, I mean, that looked good on paper, but it was, in terms of delivery and implementation, there's still a lot to be done. So there's a few learnings from this that we can probably discuss on, and I'll get to that later on. Thank you very much.
Thank you very much, Rabi. I'm going to turn to Anita. So Anita, your organization, IT for Change, has as its motto to work towards bridging development realities and technical possibilities. So to start with, can you tell us what some of those technical possibilities are and how they've emerged during the pandemic?
Thank you very much. My organization works at the intersections of technology and social justice. We work directly with communities, and we also undertake research as well as work on policy advocacy at the national and international levels. One of the things that we witnessed during the pandemic, I think, is not just the significant role that technology can play in somehow making us human yet again, when it's really not possible to be public and political people out there, is the role of voluntary community action. So we actually saw, particularly in social media, the ability of communities to self-organize. And that taught us a lot about what really happens during an emergency when you really require the kind of infrastructure which may be mostly social. So the technological infrastructure, we noted, helped this kind of social mobilization. At IT for Change, we run a radio program for girls and adolescent young people, and we were able to work with the community to actually share information, dispel myths, and also address questions about what to do if there is, for instance, a case of domestic abuse at home. So the radio program galvanized into a very popular podcast at that point. We were also, for a decade, we've been running Mahiti Kendras, community-based information centers, which were ready during the pandemic to take and run with the demands and imperatives that were required during relief. So there were government schemes, there were targeted reliefs from local philanthropies. And what the Mahiti Kendras were able to do is to segment information, to categorize deserving populations, especially single women, households, and they were able to target relief. Our work in education and free and open source software enabled us to regroup, go back to the drawing board and see how we can prepare teachers who themselves were taken aback by this kind of a paralysis that was caused by the virus. So they had not delivered lessons online, and therefore it was necessary for us to train the public systems. And the effort that we had put in over time was very, very useful. In all of this, we were acutely conscious that technology is not like a magic pill. And indeed, the inequity of access is still a very important issue. But we were able to dip into the investments we had made in building local digital capabilities and local cultures of community-driven models. And indeed, as the Honorable Minister also mentioned, the readiness that you already have is what really helps you to run with what may be required solutions that have to be contextualized. So to just end this question, I'd like to say that our effort to put technology into the mix of things to make life better drew largely from what is the lesson for human development, that a capability approach is about long-term thinking for agency and autonomy at the edges. Also, we've been, in our research efforts, we have embarked on thinking about alternative models, right? So pilots on what does a platform cooperative look like? We don't want these big tech top-down models, which is the industry standard, but we have begun to work with community-based institutions to run alternative e-commerce initiatives. And we believe that supportive policies are the need of the hour, and we can't have inclusion by duress. We need techno-social cultures of transformation. Thank you.
Thank you very much, Anita, and it's been very inspiring to hear you all. We're going to shift gears a little bit. As I said, a lot of our audience in the chat has been asking questions around ensuring inclusion and equity and access to technology. So I'm going to start with you, Sania. In Pakistan, less than 40% of women own a mobile phone compared to 70% of men. And a large segment of vulnerable households and women do not have any digital access. So how has the divide how has this divide impacted overall service delivery and social protection programs? And what have some of the solutions been? And one of our audience members is asking specifically, how have you digitally empowered women in rural areas? Over to you, Sania.
Oh, so that's a very important question, because whenever there is a digital divide, an overall digital divide, and then the gender-centered digital divide within a context, the delivery of services which have many digital threads does become a challenge. And Anita talked about the importance of community information centers. I couldn't agree more with her, because the role of community in delivering digital and financial literacy is so very important, in addition to, of course, the traditional approaches to awareness creation and communication. Now, because we have, as part of the SAS program, we've got a 50% plus policy, which means that more than 50% of all the benefits have to accrue to women across all the strands of SAS initiatives. And we regard digital and financial literacy as being such a core element of our interventions that we single it out as one of the 5 time-bound outcome-based goals of this program. So, of course, the other 4 quantitative goals focused on the number of families we have to reach in terms of the regular social protection operations, the number of families where we have to provide financial access to healthcare, the number of individuals where we intend to provide financial access to education. And I'm talking about a social protection program, and hence the social protection lens in terms of outcome level goals. But digital and financial literacy was such a salient, and I may be repeating myself, was such a salient component of the backbone that we centered one of the time-bound outcome-based goals on it. Now, because many of our recipients are women, the question was how to improve the level of digital literacy, given the very wide gap, given the chasm, in fact, that you just referred to, Cecile. So we conducted a study to find out what the best modality would be to reach out to these very disadvantaged women in the far-flung rural areas of the country. And to our surprise, the findings made a lot of sense, but this is something that we had not thought about. The findings, in a nutshell, were that in order to target women in rural communities, you have to start with children in the house, and especially girls in the house, because they attend schools, and the potential for them to embrace digital and financial literacy is a lot higher, is far more higher than the likelihood of their mothers embracing this as one of the core aspects of benefiting from the services. And that's exactly what we are focusing on now. But an emphasis on communication, on information dissemination, on literacy-centered outcomes is not enough. In order to mainstream digital in the delivery of services for the disadvantaged, whether it is for health outcomes, for education outcomes, for social protection outcomes, for nutrition outcomes, you also have to work on the incentive structures and the infrastructure. So the cost of the mobile phone has to come down. The cost of the handset has to come down. There have to be incentives for the adoption and availability of the smartphone. There are fiscal measures that need to be taken overall to facilitate the private sector, which has a very core role to play in this. Then connectivity is, of course, as we all know, a major game changer. So in the far-flung rural areas, where the private sector will not have an incentive to invest in developing the infrastructure to facilitate connectivity, the government has to step in. And there are mechanisms and financing mechanisms and execution mechanisms. And I could talk about what my country has done and what the approach of my country is. but all of our countries have approaches to facilitating the access to connectivity in far-flung areas. So there are these different dimensions: literacy and the approach to literacy, the financial incentives, and infrastructure. But more important than that is the actual benefit that individuals see being accrued on the ground. In SR's interventions, for example, women and girls get notifications on their handsets. So they get to know through SMS whether their money has arrived, which is why every woman beneficiary of SRs has a cell phone in their pockets. And even if they're unable to read themselves, every time an SMS comes, they are very keen to know whether it is the SMS from SRs notifying their regular stipend, their school stipend for the child. So all these things have to come together in order for digital approaches to be adopted fully. And I just want to also mention, because the point about women and girls is so crucial to this whole discourse and discussion and public policy debate and action. I just want to mention that Pakistan is taking this very seriously. So we have just upscaled our national education conditional cash transfer program, where girls get a higher stipend amount compared to boys. And also in our education, in our nutrition and health conditional cash transfer program, which is running currently in 20% of the districts and will be upscaled to nationally within this fiscal year, girls get a higher stipend amount. This is to signal the importance of the girl child. And although it may be very early to quantify its impact on ground, but I think that if successive governments could continue with this policy, then the impact of a girl favoring stipend both in the education and health streams, I believe, is going to be quite profound over the course of years.
Thank you very much, Sania. And I'm going to turn to you, Anita, because I know that this is really a topic that is very close to your heart. And you've been writing extensively and studying how the benefits of digital and converging technologies need to filter down to the most vulnerable and the marginalized. So can you tell us how we collectively can address these concerns of inequality and empowerment when it comes to technologies? What does your research and practice show? Thank you.
Yes, thank you. And this is a fascinating debate, and just an hour and 15 minutes is not enough. And I also have been reading the flagship report of the World Bank, which is Data for Better Lives. And I think it's very lucid, and I may not agree with all of its findings and conclusions. But I think one thing that it manages to convey is that the data paradigm needs to be understood for what it is, right? So the axis of inequality today is the world that is defined by the digital. And so technology is not just a tool alone to adopt and use. It's also part of the mix of things that comprises a social paradigm. So it's exactly like the role of finance in the international political economy. So it defines the destiny of people, it defines the destiny of communities and even nation states. So, which is why you often hear people say that AI is a factor of production. So the way in which we think about modes of production and economics in general, is completely transformed. The countries that have gotten ahead in this gold rush for data and their corporations will control the value chains of the future. And this is bound to create new forms of dependencies. And this is already known in the literature and in the scholarship as data colonialism. And since all my data is with you, then I need to come to you all the time for the tools of decision making that I need. So this is the way the paradigm more or less gets constructed, and it reconfigures the way in which power in society and in the economy is ordered. This concern needs to be addressed through measures for tech sovereignty, and the old logic of technology transfer is really not useful at the international level. Also, I think that converging technologies, when you talk about converging technologies, it has one important thread, and that is thread of data, right? And that is central to all of these, that is the backbone of the technological revolution. So when you look at platforms to deliver health or education, we see one consensus, which I think we should really open up for interrogation. We tend to view data initiatives of governments as public data infrastructures that are needed to promote, per se, market participation. So we don't necessarily see these data infrastructures as deepening the cause of public education or the aim of public health to have universal and equitable health infrastructure. Somehow our imagination about the digital gets conflated with bringing a certain privatization, which will then benefit the market. Now, I mean, I think markets are vital, and Professor Amartya Sen says that the last woman standing should be able to participate in markets. So I'm not taking an essentialist view of markets. What I'm saying is somehow equity tends to be subordinated to the commercial interest. And there are innumerable examples, like in the case of the UK, health services providing patient data to Google's DeepMind AI program for developing a diagnostic app for kidney disease. We really don't know if kidney disease will come down, but what we know is data is making its way to Google's DeepMind. And I would say that in the region, in my country as well, this is more or less the kind of approach in the building up of the digital data stacks, you know, the national data stacks for agriculture or for education or for health. I also want to point out that many of these tend to also get over-valorized quite quickly. So for instance, there's a program in India called Diksha, which is an education platform owned by the government. And many state governments in a federal system have pointed out that they're increasingly becoming dependent on a philanthropic foundation that supports the platform. Now, that's not very good for the public education system, and the impact assessments of these things become very important, and we shouldn't reduce success to, you know, the number of downloads of or the number of daily hits on the site. Success is really when education is equitable, right? So the metrics that are used between quick outputs and long-term outcomes, those are needed to be interrogated. And so to just wrap up, I think that we really need to be a little bit slow in adopting these models. We also worry very much in civil society, and I come from an NGO, and therefore these are questions for our research and advocacy. We have done extremely well in rapidly producing our health surveillance platforms in India. And that is thanks to a technological community and very favorable policies. However, the CoWIN application model that's developed for the management of vaccine delivery, now being exported to 50 countries, despite its success, has some concerns which we want to bring to the table. The application is dealing with concerns about exploitation by bots, which are automatically booking slots, concerns of exclusion, new privacy concerns about emerging APIs for the private sector to verify vaccination statistics. Many people want to verify whether you are actually vaccinated and directly can go up on the portal and check this out. So that we think is an invasion of privacy. So what I would like to really say is that many of the global development models, like the Digital Public Goods Alliance, although it talks about public goods, it doesn't really talk about public interest and what would serve equity. And I think that public goods provisioning, public data infrastructure provisioning, and equity, inclusion, and values of accountability, all of these things have to go together. Otherwise, we will actually end up with a data and digital paradigm that excludes and causes harm. So this is actually, I think, the bottom line that I really wanted to bring to the table.
Thank you. Thank you very much, Anita, for that very passionate intervention and appeal for really looking at all of these dimensions and the benefits, but also the risks. So I'm very keen to turn our conversation now to regional cooperation. And the key question really is there an opportunity through technology in human development to enhance cooperation? So I'm going to turn to you, Mamun, and I'd really like to understand from the health perspective, where do you see opportunities for collaboration, be it in health treatment, in research and development, or disease surveillance? Over to you.
Thank you. And one thing I would like to add here, that actually in the regional collaboration and also service, data is so important. And I agree with Anita about the data, but without the data, we cannot make informed decision. I always a good believer of like making the decision with all the information on our hand. It could be education, it could be health, it could be in other areas. That context, access, if we want to build an access to healthcare for the people in the South Asian region, and data is very important. If we don't have the data, we cannot actually know, we don't know where the most important service is needed. Okay, in that context, I would like to share few examples that actually we are seeing. Like in Bangladesh, who are vulnerable population, like a poor, who don't have access to healthcare. And it is the same scenario in different South Asian regions. And what we found that through our digital data-oriented healthcare services at the doorsteps, we can actually able to reach most vulnerable people, especially women who are neglected through their like a man-dominating society. They don't get the access to healthcare. Now, they like health workers with the technology, they're going to their doorsteps, and with the service, they are getting to know that what disease they are actually suffering. And based on the data, the system like AI can help them what is their future risk and where they need to go and where they need to get treatment. So in that way, actually that helping them to actually getting the better service and better quality of life. And on the other hand, with the data, we can see that last 1 year, we found that the healthcare cost is reduced compared to it was 6 months on average. So that's why data is important. So therefore, in the context of regional cooperation, we have to build a digital health systems. If we can build digital ecosystems, which includes a lot of things like wearables, genomics, big data, connected health, and so on. If we can do that, we can easily make the healthcare more on patient-centric. Like in the context of South Asian region, all the country is pretty similar, and their healthcare is the most the physician-centric. If we can have a patient-centric healthcare, which developed country already converging, so that we can have a better access to information, we can ensure more quality of service, and on top of that, we can bring efficiency, accessibility, accountability, and trust, which is so important. Now it comes to the next level. When the people are get sick, what to do? Then in that context, we also need the opinions, second opinions. So if we have the data and we can build an AI systems, when doctor is treating patient, our intelligence systems can help doctors to give better treatment with the information, with the cases that they treated previously based on the data. So that's why I call it, it could be second opinion will be provided by the AI model so that they can have a better treatment, because it generates the evidence, and based on the evidence, they can provide better treatment to the people. So in the context of regional cooperation, research, disease surveillance, we need to work together in the context of different educational institutes, different research centers, and industry. Work together and helping each other to actually empower them. One thing always I believe, if I live in everything is good, but if my neighbor is not having a good life, that will not ensure sustainability of my good life. In that context, if South Asian, one of the country having the big power and big quality of life, high GDP, but neighboring country is suffering, that actually not ensures the sustainability in that context. So we, all the South Asian region, need to work together, need to have a bilateral cooperation on research, design, development, especially for reducing the healthcare cost, providing data-driven healthcare solution treatments, and also disease surveillance, because that COVID actually shown us how quickly a disease can be transmitted and can turn to a pandemic, big pandemic. So in that way, we can actually prevent that consequences with our bilateral mutual cooperations among the South Asian country. Thank you.
Thank you very much, Mamun. And I'm going to ask a similar question now to Rabi. Can you give us examples of effective cooperation across countries of South Asia in education, and maybe what are the prospects going forward?
Thank you, Cecile. When you look at the education sector, sadly, we do not see so much of a cross-border cooperation and collaboration. Although I think we do see a little bit of what we see is in the private schools and private sector, and we do find among private schools they're sharing certain technology platform, the content, and the content's usually the proprietary software that's provided by a private company. But on a national level and state level, there's very little that's going on. But the potential is very high, and the possibilities are there. I think the kind of collaboration, among other things, and there's a platform, there's content, the kind of one of the key areas where I think the collaboration would really help is kind of success stories and good cases where we can find sort of successful models that have been implemented in different parts in the region. And so how can we learn from that and sort of adapt it, not just take it and bring it to another place, but how can we adapt so it contextualize in the local context? That's going to be very important. So also the key important thing for this reason, in 2007, when we started this initiative, one of the things that we sort of proposed to the government in the discussions we brought up was, look, I mean, there's already so much disparity in educational outcomes. Even in 2007, even before we actually introduced any technology in schools, these kind of disparities are across population groups, different regions, in school types. And if we do not take steps collectively to actually address this issue, technology can only make it worse, because what we find is, more and more the haves and have-nots, that the chasm is going to widen, because students with access to resources with technology will continue to do well and improve, whereas the large majority of the students in public school system who don't have access to these kind of devices and connectivity and resources are going to be left behind, and that's only going to widen the kind of divide. So it is very important for us to take this concerted effort from the government side to say that, okay, we are going to come up with policies, plans, and strategies to introduce technology and ICT in schools so that children have access to better learning methodologies. And we were successful to a certain extent. I mean, we were able to do it, but due to very kind of the kind of weak governance and the changing kind of political environment makes it very difficult for organizations like ours to really scale the work that we do. We can show success in small pockets, but it's very difficult to sort of expand in large scale. And what we also find is there's kind of misleading information. I would say, when last year at the start of the pandemic, a lot of people relied on this data that Nepal has a very high cellular penetration. It's almost in the kind of upper 80s, right? So 80%, 88% cellular penetration. But that's a very misleading data, because like I said earlier, they may have access to cellular data, but cellular data is very expensive, and most of the parents don't have, smartphones. They're using this kind of simple phones. And even those who have smartphones, you cannot really expect one household who have 5 children to be using one phone that the parent has to continue their learning. That's too much to ask there. So where we have to really invest in is we have to invest in children. We have to invest in devices, not so much connectivity. And connectivity is there. I mean, when we started the initiative, we also said we're not going to rely on internet connectivity, and we always look to providing kind of offline access to students to learning resources, putting offline digital library servers in schools and communities. That can be a great way to actually provide easy access to students. Cellular connectivity is great for notifications, for sort of time updates and from time to time, but we cannot rely on it for continuous access to learning resources. That can be done through offline servers. So we made that effort to put it going to the local levels and doing it. But now what we find is, the schools have devices, and then we're coming up with models where students can check out the devices. If they're at home, if they're only coming to school on a limited basis because of the pandemic, they can utilize the resources where they actually still have connection to the schools, but they're coming, taking turns to come, but they can also learn at home. And it's not just relying on the devices only, but to provide the kind of a kind of workbook and learning sort of lesson planning where they can do things at home, sort of offline work, research projects they can do and then come and share in schools. So going forward, I think the regional cooperation where we can actually work together is how can we ensure that these population groups who have no access are provided with some kind of devices. We have to invest in that. I think one of the panelists also earlier talked about how can we bring down the cost. I think if the governments and states work together, there's no way, we can bring down the cost of tablets and other kind of devices that students can use at home. So two things is, one is I think learning from each other in terms of success stories, and other is working in a concerted manner to make sure that the students, the children, the communities, the marginalized communities, girls and other communities have this access to these devices. And that's imperative, because what I see is even last year in Nepal, with a lot of funding coming from Gold Partnership for Education in response to COVID, most of that money went to training teachers for online teaching, for setting up studios for creating video lessons. But if the students don't have devices to sort of connect with that, those are all useless. Thank you.
Thank you. Thank you, Rabi. So we are starting to run out of time, unfortunately. This is such a fascinating conversation. I'm going to turn to you, Anita, very briefly. From where you sit, where do you see regional cooperation happening and what are the opportunities?
Yes, so quickly, I think I would like to see, like Mamta mentioned, the whole policy area is a very important thing. And I think oftentimes in the area of digital and data governance, we tend to be very Eurocentric, and I think that needn't be. I think the experiences from this panel tell us that from public institutions, the government, to civil society interventions, there's a wealth of experience. And I think we should have a uniquely South Asian, Southern approach to data justice, so we should actually, even the SRS program conceptualizes rights and claims and entitlements from a social justice perspective. So I'd like to really look at broadening digital rights and data rights into a data justice approach. I think there would be possibilities even for scholarly kinds of exchange. We should actually call for policies that can look at what's being implemented on the ground, do impact assessments, call for appropriate regulation and governance of, let's say, digital health initiatives, do before-after kind of studies, longitudinal surveys. And these would be extremely helpful and set the pace for the participation of civil society in different respects. I also think that there is a lot of role for forging and learning about data governance, not only in the privacy areas, but also in the area of the economy, where I think we can look at what can really be useful to look at the commercial surveillance. How do you really create a level playing field in the market? And how do you imagine these new infrastructures of data stewardship? Like if you want to promote community ownership of data, which can be a uniquely South Asian contribution to the European model of an individual-centric society, I think what would it look like? And I think that here we should be able to work together, I would say community to community, as well as government and community, and create a positive kind of a momentum. So thank you very much.
Thank you. And same question to you, Sania. I know that a lot of people have been studying the Pakistan example, and how has that had an effect in South Asia more broadly?
I think we have to look at options on a spectrum. And on one end of the spectrum, you can have, experience sharing as the outcome of interest. So the right platforms that allow government-to-government exchange with civil society and academic engagement from across the region. A setting where you can have frequent ongoing exchanges at a periodic level, where you can have demand-driven questions posted, and where where the regional collaboration can be around specific questions and specific problems, because our systems of all the South Asian countries have evolved from the colonial context, so that there's a lot of system similarity. So I think at one end of the spectrum is this experience sharing, the knowledge platforms as its tools in its various shades and hues. That's the bare minimum which we should be doing. And if the structures are not functioning, I think institutions such as the World Bank can help create those. I think that is at one end of the spectrum. At the other end of the spectrum, you have more concrete institutional arrangements of collaboration, the common frameworks, the common regulatory arrangements, the policy convergence, common institutions, pooling of resources and pooling of expertise. And unfortunately, some of the institutions that were mandated to do this, such as the South Asian Association for Regional Cooperation, hasn't done very well. But I think at the bare minimum, we should have platforms for academic exchange. That is the least we can do.
Wonderful. So to conclude, I'm going to ask each of you in less than a minute to just leave us with one thought. If there was one thing, one recommendation in terms of improving regional cooperation on this important topic, what would it be? Rabi, I think I know your answer, but let's hear it. Devices.
So one thing I think the World Bank Group can also assist in Nepal, and I believe in other, and the whole reason is empowering the local institutions to be able to deliver these different services using technology. So Nepal has just started with the federal system. It's only been a few years, we're still experimenting, but what I see is a lot of potential there if we empower the local bodies to be able to deliver health, education, job prospects for the people. When we started working in this in 2007, everything was centrally controlled. It was very difficult to work. And now in the local level, we see that the local elected officials are very keen to work. So if we can allow them, give them the power so that they can also collaborate with different groups, maybe they can work with a local body in Bangladesh, to be able to collaborate and work that. If that can happen, I see that, we can really move forward. And if we can have a jointly, for the reason to have this commitment that we are going to work together, uplift this whole region so we can really take advantage of the fourth industrial revolution. And so that we have the human capital in the region to take advantage and do well. I think that would be my parting message. Thank you.
Hey, thank you, Rabi. Mamun.
Thank you. I think the digital health inclusion, actually creating digital health account for every citizen, not only in Bangladesh or India, in all the South Asian people, and through adapting the technology, which will help to create digital health ecosystems. And in that way, we can actually we need to emphasize on more preventive and primary health cares to actually reduce the workload and cost and the burden of secondary and tertiary healthcare. In that way, we have 10 years to achieve universal health coverage. So what I envision in next 10 years that the digital health inclusion actually help us to achieve universal health coverage and create equity and better South Asian region with a good health and well-being. Thank you.
Thank you, Mamun. Anita.
Yes, thank you. I actually thought the previous round was when the Honorable Minister had the last word, and I wanted to say bravo, because the least we can do is to actually share knowledge and build a kind of academic community. And I think that this should also be partly to do with how the community can co-construct technology. What is the meaning of a technological revolution if it's not being led by the people? And I think that in this cooperation, there will also be the questions that we all have to ask ourselves from our different locations, in the roles that we are performing. What is that kind of social design or a techno-social design that will ensure autonomy and sustainability to make technology not just accessible, but also meaningful, and from the point of view of people's participation, transparent and accountable? Thank you.
Thank you, Anita. And the final word to you, Sania.
Very exciting listening to all the colleagues from the neighboring countries. I just want to say, as the last point, that data is an input. Technology is a tool. they're not ends in themselves. They're meant to work, they're meant to make systems work better. They're meant to improve evidence-based decision-making and enhance efficiency and effectiveness. And our outcome of interest is that the systems of public sector delivery that have been plagued by inefficiencies and all kinds of pilferage and rent seeking should be transformed with the use of evidence-based decision-making that's data-driven and through technology, which brings in its wake a number of different benefits. And that is our goal. Sometimes we tend to think of data and technology as ends in themselves, and that's not the case. The outcomes of interest are still a good quality healthcare, universal access to good quality education, improved nutrition, and social protection for all. And when we do not lose sight of these outcomes of interest, and when we look at data and technology in the right perspective, then our objective should be to create the new systems where technology, policy, and innovations come together. And I think that experience sharing, knowledge sharing across countries would be extremely helpful, because we're all struggling and we're all at the same stage of the learning curve. So I'll just leave it at that. Thank you.
Thank you very much. And this takes us to the end of our conversation, which I must say with a little hint of disappointment for me, because I would have liked to continue for much longer. This has been so rich and so fascinating. There is no way I can do justice to the richness by summarizing, but I do want to just leave us with a few final thoughts. The first is, as we have all acknowledged, there is a wealth of human potential in this region. And technologies, if they are used well, can certainly harness this potential. But at the same time, this conversation and the book that underpins the conversation show that it is very important that we use technology wisely so that it can ensure access and equity, and that the benefits filter to the vulnerable groups for greater public good. We've heard about some of the challenges of governance, inequity, and inclusion, and also the potential for greater collaboration in this region. It is nascent, it is underutilized, but certainly we've heard many of the threads around opportunities for more knowledge exchange, experience sharing, for working together on digital infrastructure and connectivity, governance, policy, and regulatory frameworks, global advocacy, strengthening the South Asia voice, and also on bridging some of the digital divides and digital literacy. So there is definitely scope for collaboration in a number of areas: scientific, academic, building capacity jointly, more open source platforms, bringing down the cost of services through devices and programs like the one that Mamun has described, for sharing data and knowledge and technological innovation. And also really going back to Anita's point, digital justice, having a common framework for that. So I do hope that today's conversation has triggered more opportunities for cooperation in South Asia. And we certainly do look forward to seeing some of that take place. I'm going to quickly read out the results of our poll. So our poll was asking, what policy should South Asia countries prioritize to improve the use of technologies to build human capital? The highest number of votes goes to promoting data literacy, 42.7%. And I think that is very, very much in line with our conversation today. That's followed by improving technology-based service delivery at 26%, promoting digital accessibility at 19%, and finally strengthening data governance at 12.3%, which I think this conversation shows that maybe that should be at a slightly higher level given the importance of that topic. So with this, I want to thank our audience for participating and for being so engaged on our live chat page. to all of our wonderful panelists, to Mamta, Murthi, who I think stayed with us for the whole of the event, our Vice President for Human Development, to the authors of the report for putting out such a fantastic book and prompting such a wonderful conversation. And I want to thank my amazing team who does a lot of work behind the scenes to put this together, as well as our conference services here at the World Bank. We will be posting this conversation online, and we will continue to keep this conversation going through social media. You can use our hashtag #OneSouthAsia, and please join us in 2 months for our next conversation. Thank you all very much, and I wish everyone an excellent day or evening wherever you are. Thank you very much.